Your shoulder pain isn't a rotator cuff problem, and the real fix is simpler than surgery. I'm going to share 5 strategies with you today that eliminate shoulder pain without injections, without surgery, and without expensive physical therapy. Most orthopedic surgeons look at your MRI, see a rotator cuff tear or impingement, and recommend surgery. But in 15 years of treating shoulder pain, I've learned that the majority of shoulder problems come from muscle imbalances and movement patterns that are completely correctable. I've watched hundreds of patients cancel their shoulder surgeries after implementing these 5 strategies. Today, I'm going to show you exactly what they did. Let me ask you something. Does your shoulder hurt when you reach overhead? Does it ache at night when you lie on it? Do you have pain when you reach behind your back? Maybe you've had an MRI that showed a rotator cuff tear or shoulder impingement and your doctor recommended surgery or cortisone injections. What if I told you that rotator cuff tears are present in 50% of people over 60 with 0 pain? That the tear on your MRI might not be causing your pain at all? What if the real cause is a muscle imbalance that you can fix in 8 weeks with 5 targeted exercises? I'm going to prove it to you, and I'm going to give you the exact protocol. Here's what frustrates me about how we treat shoulder pain. Someone develops shoulder pain. They get an MRI. The MRI shows rotator cuff pathology, maybe a partial tear, maybe impingement, maybe tendinitis. The orthopedic surgeon says, you need surgery, or at minimum, cortisone injections. The patient gets a cortisone injection. The pain improves temporarily. 3 months later, it's back. Maybe they get another injection, then another, eventually surgery. But nobody asked why the rotator cuff was damaged in the first place. Nobody addressed the underlying muscle imbalances and movement patterns that caused the problem. And here's what concerns me. Cortisone injections actually damage tendons with repeated use. They provide short-term relief while accelerating long-term damage. And shoulder surgery has a high complication rate and long recovery time, often 6 to 12 months. Many patients are no better after surgery than they were before. Shoulder pain destroys quality of life. You can't sleep on your side. You can't reach overhead. You can't throw a ball with your grandchildren. Simple tasks like putting on a shirt or reaching into a cupboard become painful ordeals. Every movement reminds you that something is wrong. Think about the next 5 years if your shoulder continues declining. More pain, more injections, eventually surgery, possibly poor surgical outcome, long painful recovery, permanent loss of function. That's not what you want. Let's fix this right now. The first and most important strategy for fixing shoulder pain is restoring proper scapular stabilization. Your shoulder blade, your scapula, is the foundation of your entire shoulder. When it doesn't move properly, everything above it breaks down. Here's the anatomy. Your rotator cuff muscles connect your upper arm to your shoulder blade. For these muscles to work properly, the shoulder blade must be stable and positioned correctly. When your scapula stabilizes, particularly your lower and middle trapezius and serratus anterior are weak, your shoulder blade wings outward and tips forward. This abnormal position changes the mechanics of the entire shoulder joint. Your rotator cuff muscles become pinched between bones, a condition called impingement. They work at mechanical disadvantage. They become overloaded and damaged over time. Pain develops. Studies show that 90% of people with shoulder impingement have significant weakness in their scapular stabilizers. Fix the scapular stability and the impingement resolves. But most people do shoulder exercises that work the wrong muscles. They do front raises and lateral raises that actually worsen scapular positioning. They do bench press and push-ups that strengthen the front of the shoulder while neglecting the back. The imbalance grows, the pain continues. I had a patient, William, 61 years old, whose shoulder had hurt for 2 years. His MRI showed shoulder impingement and a partial rotator cuff tear. His surgeon recommended rotator cuff surgery. He came to me for a second opinion. When I assessed his shoulder mechanics, his scapular stabilizers were severely weak. His shoulder blade winged dramatically when he raised his arm. His lower trapezius barely activated. His serratus anterior wasn't working. His rotator cuff was being pinched with every movement because his shoulder blade was in the wrong position. We did 0 rotator cuff exercises. We focused entirely on scapular stabilizers, wall slides, prone Y and T exercises, serratus push-ups. Within 3 weeks, his shoulder blade sat properly. Within 6 weeks, his impingement resolved. Within 8 weeks, he was pain-free. Surgery cancelled. Your action step. Do these 2 scapular stabilization exercises daily. Wall slides. Stand with your back and arms against a wall, arms at 90 degrees, elbows bent. Slowly slide your arms up the wall as high as you can while keeping them in contact with the wall. Feel your shoulder blades move and squeeze together. Slide back down. Do 3 sets of 15 repetitions daily. This activates your lower trapezius and restores proper scapular movement. Prone Y exercise. Lie face down on a bed with your arm hanging off the edge, thumb pointing up. Raise your arm at a 45-degree angle from your body, making a Y shape. Squeeze your shoulder blade down and in. Hold 2 seconds. Lower slowly. Do 3 sets of 12 repetitions on the painful side. Within 2 weeks, you'll feel your shoulder blade stabilizing differently. Within 4 weeks, significant pain reduction. Within 8 weeks, your shoulder mechanics will be restored. The second strategy is strengthening the posterior rotator cuff muscles, specifically the infraspinatus and teres minor. These muscles externally rotate your arm and are almost universally weak in people with shoulder pain. Here's why this matters. Modern life creates massive strength imbalances in the shoulder. We push constantly, computers, steering wheels, carrying bags, but we rarely pull. This develops the front of the shoulder, internal rotators, while neglecting the back of the shoulder, external rotators. The result is a forward shoulder posture. Your shoulder rolls forward. The head of your upper arm bone moves forward in the socket. This compromises the space for your rotator cuff. Tendons get pinched. Inflammation develops. Pain follows. Your external rotators, infraspinatus and teres minor, are supposed to hold your arm bone centered in the socket. But when they're weak, your arm bone migrates forward. Your shoulder mechanics break down. Studies show that improving the strength ratio between external and internal rotators reduces shoulder impingement and resolves rotator cuff pain in 70% of cases. I worked with a woman, Patricia, 55, whose shoulder had hurt for 18 months, multiple cortisone injections, physical therapy that hadn't worked. She was scheduled for arthroscopic surgery in 6 weeks. When I tested her rotator cuff strength, her external rotators were 40% weaker than her internal rotators, a massive imbalance. Her arm bone was sitting forward in the socket with every movement, grinding her rotator cuff. We implemented external rotation strengthening, resistance band external rotation, side-lying external rotation with light weights. Within 3 weeks, her strength balance improved. Within 6 weeks, her pain decreased by 70%. She cancelled her surgery. Within 10 weeks, she was completely pain-free. Restoring external rotator strength had fixed what surgery was supposed to fix. Your action step: strengthen your external rotators daily with this exercise. Resistance band external rotation. Secure a resistance band to a door handle at elbow height. Stand sideways to the door, keep your elbow bent at 90 degrees and pressed against your side. Hold the band with your inside hand. Rotate your forearm outward, away from your body, against the resistance of the band. Keep your elbow still and against your side. Rotate as far as comfortable, return slowly. Do 3 sets of 20 repetitions on the painful side. Do this every single day. The external rotators respond well to high-frequency training. Within 2 weeks, you'll feel greater strength and stability. Within 6 weeks, your shoulder mechanics will significantly improve. The third strategy is improving thoracic spine mobility. Your mid-back and your shoulder are intimately connected. When your mid-back is stiff, your shoulder has to compensate by moving excessively. This overloads the shoulder joint and causes pain. Here's the biomechanics. When you raise your arm overhead, the motion comes from 2 places: your shoulder joint and your thoracic spine. Your thoracic spine should extend and rotate as your arm rises. This is called scapulohumeral rhythm, and it requires thoracic mobility. But most people over 50 have severely stiff thoracic spines. Decades of sitting, poor posture, lack of extension movement, their thoracic spine barely moves. When they try to raise their arm overhead, all the motion must come from the shoulder joint. The joint is overloaded, tendons get impinged, pain develops. I see this constantly. Someone says they have shoulder impingement, but the real problem is a locked thoracic spine. Improve thoracic mobility, and the shoulder pain resolves without any shoulder treatment at all. The research shows that improving thoracic extension, mobility, increases overhead shoulder range of motion by 20 to 30 degrees, and reduces shoulder impingement significantly. I had a patient, George, 67, who couldn't raise his right arm above shoulder height without severe pain. He had classic shoulder impingement on imaging. But when I assessed his thoracic spine, it was locked solid. Almost no extension, almost no rotation. We did 0 shoulder exercises. We mobilized his thoracic spine exclusively. Foam roller thoracic extensions, seated thoracic rotations, open book stretches. Within 2 weeks, his thoracic mobility improved dramatically. Within 4 weeks, he could raise his arm overhead without pain for the first time in 2 years. Your action step: mobilize your thoracic spine daily with 2 exercises. Foam roller, thoracic extension. Place a foam roller horizontally under your mid-back. Support your head with your hands. Arch backwards over the roller. Hold for 5 deep breaths. Move the roller 2 inches higher. Repeat. Work your way up your entire mid-back. 3 minutes daily. You'll feel and hear your thoracic spine releasing. Open book stretch. Lie on your side with knees stacked and bent at 90 degrees. Arms out in front, palms together. Keep your bottom arms still on the floor. Rotate your top arm up and over toward the floor on the opposite side. Follow it with your eyes. Hold for 3 breaths. Return. Repeat 10 times each side, twice daily. Within 1 week, your thoracic mobility will noticeably improve. Within 3 weeks, your overhead shoulder movement will significantly increase. Within 6 weeks, shoulder impingement pain will dramatically decrease. The fourth strategy is correcting your sleep position. Many people with shoulder pain have no idea that they're aggravating their shoulder for 6 to 8 hours every night. Your sleeping position may be the single biggest factor keeping your shoulder inflamed. The worst position for shoulder pain is sleeping on the affected shoulder. This puts direct pressure on the inflamed tendons and bursa. It compresses the rotator cuff against the bones of the shoulder for hours. You wake up with your shoulder more inflamed and painful than when you went to bed. The second worst position is sleeping on your back with your arm across your chest or beside you with your shoulder internally rotated. This position keeps your shoulder in a closed pack position that impinges the tendons all night. Many people sleep in these positions for years and wonder why their shoulder never heals. Every night they inflame it. Every day they do some activity that improves it. 2 steps forward, 2 steps back. They never make progress. The best position for shoulder pain is sleeping on your back with the affected arm supported in slight external rotation, or on your non-painful side with a pillow hugged to your chest to prevent rolling. I had a patient, Carol, 58, whose shoulder pain was worst in the morning. She could manage it during the day. But every morning she woke up in severe pain. It took her 2 hours to loosen up. She'd been sleeping on her painful shoulder for 20 years. We changed her sleep position. Back sleeping with a pillow under her affected arm to keep it in slight external rotation. The first week was uncomfortable, new position. But within 10 days, her morning pain decreased by 60%. Within 3 weeks, she was waking with minimal pain. Her shoulder could finally heal overnight instead of being re-injured. Your action step: change your sleep position tonight. If you sleep on the painful shoulder, stop immediately. This is the worst thing you can do. Retrain yourself to sleep on your back or on the opposite side. For back sleeping, place a pillow under your affected arm. Position your arms slightly away from your body, with your thumb pointing upward. This keeps your shoulder in external rotation and decompresses the tendons. For side sleeping on the non-painful side, hug a firm pillow to your chest with the affected arm resting on top of it. This prevents your shoulder from rolling forward. It also keeps your rotator cuff in a non-impinged position. It will take 1 to 2 weeks to adapt to a new sleep position. Push through the adjustment period. The result is that your shoulder will heal overnight instead of being re-injured. Within 2 weeks, your morning pain will dramatically decrease. The 5th strategy is reducing systemic inflammation. Your rotator cuff tendons are inflamed. Anything that increases systemic inflammation makes your shoulder worse. Anything that reduces systemic inflammation helps it heal. This is the strategy most people completely ignore. They focus only on local shoulder treatments, exercises, ice, massage. But if your body is chronically inflamed from diet, poor sleep, stress, and inactivity, your tendon inflammation stays active. The shoulder can't heal. The same inflammatory foods we discussed in the arthritis video are inflaming your rotator cuff. Refined carbohydrates, sugar, seed oils, processed foods. These foods trigger inflammatory cytokines that travel to your already irritated tendon and amplify the inflammation. Conversely, anti-inflammatory nutrition powerfully reduces tendon inflammation. Omega-3 fatty acids from fish oil, curcumin from turmeric, antioxidants from vegetables and berries. These compounds directly reduce the inflammatory chemicals causing your shoulder pain. The research shows that high-dose omega-3 supplementation reduces tendon inflammation as effectively as NSAIDs. Curcumin reduces inflammatory markers significantly. Anti-inflammatory diet changes reduce shoulder pain alongside structural treatments. I worked with a man, Frank, 64, whose shoulder had been inflamed for 3 years despite exercises and physical therapy. His diet was terrible: fast food, soda, processed snacks daily. His CRP, his inflammatory marker, was 9, severely elevated. We addressed his diet aggressively, eliminated all inflammatory foods, added high-dose fish oil and curcumin. Within 3 weeks, his CRP dropped to 2. Within 1 month, his shoulder pain decreased by 50%, even before the exercises had time to fully rebuild his strength. Reducing systemic inflammation had given his tendons a chance to heal. Your action step: implement anti-inflammatory nutrition and supplementation. Eliminate all refined carbohydrates, added sugars, processed foods, and seed oils. These directly inflame your tendons. Add anti-inflammatory foods, fatty fish 3 times weekly, abundant vegetables, berries daily, olive oil as primary fat, nuts and seeds. Supplement, high-dose omega-3 fish oil, 2 to 3 grams, combined EPA and DHA daily. Curcumin with piperine, 1,000 milligrams twice daily. These are powerful tendon anti-inflammatories. Within 2 weeks, your systemic inflammation will decrease. Within 1 month, your tendon inflammation will reduce significantly. Combined with the 4 structural strategies, your shoulder will heal from the inside out. Now let me tell you what happens when you implement all 5 strategies over the next 8 weeks. Week 1, you begin scapular stabilization exercises daily. You change your sleep position. Your morning shoulder pain decreases within the first week. You start anti-inflammatory nutrition and fish oil. Week 2, you add posterior rotator cuff strengthening. You begin thoracic mobility work. Your shoulder blade starts sitting in a better position. Your range of motion begins improving. Week 3, your systemic inflammation is dropping. Your shoulder mechanics are improving. Your pain is down 30 to 40% from baseline. You're sleeping better because your shoulder isn't being re-injured overnight. Week 4. All 5 strategies are now daily habits. Your scapular stability has improved noticeably. Your external rotators are stronger. Your thoracic spine is more mobile. Your pain is down 50 to 60%. Week 6. Your shoulder mechanics are significantly restored. You can raise your arm higher with less pain. You can sleep on both sides. Daily activities are much more comfortable. Week 8. Your shoulder pain is minimal or completely resolved. You understand what caused the problem and how to prevent it from returning. You've avoided cortisone injections. You've avoided surgery. You've avoided months of recovery. You're back to full function. This is what I've seen happen hundreds of times. Not with surgery, not with injections, with 5 targeted strategies that address the real causes of shoulder pain. I want you to imagine something with me. It's 2 years from now. You never implemented these strategies. You got the cortisone injection, temporary relief, then it came back. You got another injection, then another, eventually surgery, 6 months of painful recovery, and your shoulder still isn't right. You can't sleep on your side. You avoid overhead activities. You've modified your life around your shoulder limitation. Your surgeon says this is the best outcome possible. You've accepted chronic shoulder problems. Now imagine the alternative. You started these 5 strategies today. You stayed consistent. It's 2 years later and your shoulder is completely normal. You sleep on either side. You reach overhead without thinking about it. You play golf, swim, throw with your grandchildren. Your shoulder is strong and pain-free. You avoided surgery entirely. Which future do you want? The choice is entirely yours. I've given you 5 evidence-based strategies that have helped hundreds of my patients fix shoulder pain without surgery. They're simple, they're free, they work, but they require consistency. So here's what I want you to do right now. Start with 1 strategy tonight. Change your sleep position, or do your first set of wall slides, or order fish oil and curcumin. Pick one. Start tonight. Your shoulder can heal. I've seen it too many times to doubt it. But healing requires giving your shoulder the right mechanical environment and the right nutritional environment simultaneously. And that starts right now. If this video helped you, share it with someone considering shoulder surgery. There are millions of people about to undergo operations that might not be necessary. Show them there's another option. And if you want more strategies like this, evidence-based medicine that avoids unnecessary surgery, subscribe to this channel. I post new videos every week. Your shoulder has been asking for the right treatment for years. Now it's your turn to give it what it actually needs.